Okay, so I have to say this wrist brace has been unbelievably helpful for a few of my patients that are suffering from wrist pain. So everything that I'm about to say about this wrist brace is purely anecdotal. I don't think there's an unbiased research out there on this brace. So who might this brace be good for? Actually, let's take it out. And it may be good for individuals having trouble doing push-ups without wrist pain. It is also good for individuals who experience pain when bench pressing. Essentially, any loaded patterns that it requires the wrist to be in extension, or in max extension, I should say. If your wrist also seems unstable or subluxes or moves out of the way or clicks, pops while doing activities that you like, let's say bouldering, it might be a good idea to also try out this brace out to help stabilize the wrist. I have patients that fit all of these profiles that have trialed the brace and found it extremely helpful. I would definitely recommend you to give it a trial as well. Okay, so the product itself says that those with TFCC tears will have an immediate change in weight bearing tolerance. It is essentially saying that it will reduce your wrist pain if you have a TFCC tear, although it is not promising to get rid of the pain. And you might ask, man, what's a TFCC? TFCC essentially stands for Triangular Fibrocartilage Complex. It is essentially a combination of a tendon, ligaments, and a cartilage that is situated between your wrist. I can talk extensively about the technology behind the TFCC and the wrist, but for the purpose of this video, we are strictly going to be talking about the wrist brace. If that's something that you would like to know a little bit more about, feel free to comment down below and I may consider making a video on it, because the technology behind the TFCCs is fascinating to me, at least to me. Although the product says that it is helpful for individuals with TFCC tears, most people watching this will likely not have access to imaging or confirmed imaging of a TFCC tear. And I don't think it matters all that much. And that is because it may be worth trying the wrist brace anyways if you have a confirmation that the TFCC tear is intact and you're experiencing wrist pain. So how do you know if this truly makes a difference? The product comes with great set of instructions to get an objective number on how much of a difference this brace is making when you use it. What you would want to do is essentially weigh how much pressure you can put through your wrist without the brace, and then weigh how much pressure you can put through your wrist with the brace. Of course, the instructions on the box is strict about using a non-digital scale. However, we like to break rules over here because I don't have a non-digital scale. So I use my electronic digital scale and it worked out fine. So hopefully yours will work out fine as well, because I don't know anybody that has a non-digital scale in today's world. So, okay, so why do I think it helps? Now, everything that I'm about to say is not 100% certain. It is only based off of my understanding of the anatomy and the human body. Okay, let's get this thing on. Now, it's not as hard to put on as I'm making it out to be. I just struggle with simple things sometimes. Okay, I'm gonna cut a lot of this out. Okay, I figured it out. It's really not that hard to put it on. Okay, so why do I think that it is helpful? Well, the first thing is that neurologically, there's something to be said about tactile feedback or feedback from light pressure that can increase our proprioceptive or our overall awareness of joint positioning and muscle activation, and these two together can help improve and contribute to stabilizing the joint. So now, after looking at and wearing the wrist brace throughout my day and working out with it, there's something to be said about the fact that the position of the wrist brace either helps gap the joint when we get into extreme extension, or if anything, maintain the current space of the joint when the wrist is in a neutral position as we get it into extensions to put less pressure in that area. So there's definitely something to be said about that could be influencing why you don't feel as much pain when you're wearing it. And then this is the last reason that I lean towards the most, but I won't be surprised if the other two factors that I've mentioned is playing a role in it. And that is that we have to consider that if the ligaments and tendon are impaired in any ways, there's definitely something to be said about the fact that this helps stabilize the wrist for us instead of the ligaments and tendon doing so. And in turn, that helps, of course, reduce the wrist pain that we experience when we get ourselves into any loaded positions with the wrist extended. Let me know if you agree or disagree with these reasons, and if you have any additional reasons why this might be helping, feel free to comment down below. Okay, so after wearing this brace for a bit, there's definitely a few things that you need to be aware of while wearing it. After initially wearing this brace, the first thing that I was experiencing was that the area underneath my skin where the brace covers felt a bit warmer than normal. That's something that I got used to quickly, especially after I started to move around a bit. So you may not have the same experience. Also, be sure not to put it on too tight. When I initially put it on, my hands was getting cold, and I quickly realized that I was just putting it on way too tight. So feel free to loosen up a little bit if you find that your hands are going numb or cold. The other thing to be aware of that you may feel like it is restricting your ability to go through wrist extension completely, and this is true to some sense based on the placement of the wrist brace. But when you're working out, there's something that, at least in my experience, I quickly got used to and didn't feel limited as much anymore. Oh, and one last thing, if you have a melanin skin like mine, you might want to get the cocoa butter or Vaseline ready real quick, because I found the area underneath my skin getting ashy real fast from wearing this. But you know, that's just a side note, nothing debilitating or worrisome. I would advocate to definitely go see a physical therapist or an OT to try conservative care to see if that will help with your long-term fix of the wrist pain. If not, then consider seeing an orthopedic to get a confirmed imaging to see the extensive damage in the wrist, if that is the case. So that'll be it for this video. Thank you for watching. If you got value out of this, I would definitely appreciate a like, and I would love it even more so to see you back here again, as I'm trying to grow an awesome community that cares about the human body and their well-being. So I'll see you all in a few days.